liver gallbladder cleanse and GI cleanses. And I know that many of you have also come, though, with specific questions about either personal health or family members' health, and we'll be happy to answer those. And I don't see anybody here that's going to ask about their dad with pancreatic cancer, right? So good. We may address that one later if somebody else comes on. So let's talk about liver. Let's talk about gallbladder. And then let's talk about the GI system and how these systems work together. When we look just at the body as a whole, in the torso, the largest organ in the body is the liver. Of course, the largest organ of the body is the skin. It covers the entire body, but the largest organ in the body is the liver. The liver itself has what we call a biliary tree, and this biliary tree empties out through a duct that then dumps into the gallbladder, which dumps out into the bile duct, which joins up with the pancreas, the pancreatic duct, which forms then the common bile duct, and the common bile duct then empties into the small intestine. All food that comes back, all food that enters the body goes through the esophagus. The esophagus then empties into the stomach, and the stomach then empties into this small intestine. The small intestine then digests, breaks down the food, and then that broken down food empties into the large intestine. The large intestine drapes across the front of the abdomen, toward the back again, and then down the opposite side, and out through the sigmoid and the large intestine colon on this side. The amazing thing about this is the appendix hangs here, and this small intestine here. There's a little valve here, the ileocecal valve. On this side there's a small valve, the valve of Houston. But the amazing thing about this whole system is that there is all nutrition absorbed has to come back through a blood system that then comes back up through and is filtered through this liver, this hepatic vein, and then comes back up and goes up to the inferior vena cava, superior vena cava, and back into the heart. So you can see how integral all of these systems are. Okay? Everything that we eat is digested, absorbed here, but the blood is actually then takes the nutrients and has to pass through this portal system, the liver system, to be able to be vacuum packed, sealed, turned, utilized, and delivered. So this liver becomes essential. Have you ever seen someone who has liver dysfunction, hepatitis, non-viral hepatitis, enlarged liver, liver cancer? Have you ever seen someone that has that type of condition? And what happens in their condition? How's their quality of life? Not good. Awful, right? When we see liver failure is one of those things, without a liver transplant, it's liver failure. There isn't a magic machine that you can just get hooked up to that will do all the things that the liver does. It's phenomenal, okay? So as we look at this system, again, hats off to the Creator, because this is a phenomenal system that man has not even come close to recreating. The amazing thing of this liver, though, is if you can imagine all of this nutrient and waste going through it, waste being eliminated through this system, being concentrated and eliminated through this system, it has very specific responsibilities and consequently then has very specific needs for nutrition. We've talked about those when we talked about antioxidants, but we look specifically for liver health, something we call phase 1 and phase 2 detoxification pathways. I like to liken it to, we go down to the Provo River and we have a little cup or a mug and we dip it down into the river and we pull up some water, and after a while that water starts to settle There's sediment that will settle down to the bottom, but in the water itself there still is this precipitate that's in solution. Okay? But there's the heavy stuff that's down here in the bottom. Phase 1 detoxification basically is skimming out and cleaning off. It's easy. It doesn't take a whole lot of processing. But phase 2 requires much deeper cleansing and much more agitation and deeper digging to be able to accomplish the task. Okay? So when we look at this, a couple of key constituents to this whole of the process is to be able to enable the phase 2 detoxification pathway to be very robust and healthy. Okay? We want it to be very efficient and be given the best excavators and the best dump trucks to be able to utilize and move all this heavy stuff out. So when we look at this type of a pathway, what we're really looking for then are aids that will aid these two pathways quickly. We've talked about those many times, but I'll really like to focus tonight again on the phase 2 detoxification pathway. Many of you know aids to help phase 1. Okay? Those are milk thistle and dandelion. Those are the real gentle cleansing agents, milk thistle and dandelion. You've heard about that before. Oh yeah, somebody suggested I ought to use some milk thistle. Somebody said I ought to use some beet. Somebody said I ought to use a little bit of dandelion. I ate some dandelion in my mixed greens. Great. Those are very helpful in healing for phase 1 detoxification pathways. Phase 2 detoxification pathways, though, are more specifically glutathione, alphaketoglutarate, N-acetyl cystine, let's put NAC, okay? Acetyl L carnitine. So these are very, very essential for this pathway and this process for phase 2 detoxification pathway. And as we allow that to be optimized, we'll see then the benefits that this also gives for upper body and most specifically then brain functions. Okay? These phase 2 detoxification pathways are essential because not only do they detoxify, they also help to recycle and activate other responsible communicators for higher function. Or in other words, let's say it this way. Glutathione is essential to the recirculation and recycling of neurotransmitters, and especially dopamine. What is dopamine as a neurotransmitter essential for? More specifically, what is this person that walks like this?
Parkinson's.
Parkinsonism, right? So L-dopa or sediment, Mirapex, those are all dopamine or dopaminergic activating type neurotransmitters or medications. So glutathione actually helps to recirculate and recycle dopamine as a neurotransmitter for brain, which is then the initiation of movement. Okay? So when we look at movement disorders, and we especially look at brain-based movement disorders, we really want to see this phase 2 detoxification pathway and high levels of function of glutathione. Now, if you've been to our website, you'll see Dr. David Perlmutter's video of the patient who's had delivered or administered the intramuscular injections of glutathione. Okay? You'll see a Parkinson patient that was doing just this, and then you'll see the Parkinson patient, same person 20 minutes later walking. Okay? So go to our website, the Nielsen Clinic, and it's Nielsen Clinic, and it's a .com. But go there and just have a look and see that video. It's pretty fascinating. Dr. Perlmutter, in my opinion, is one of the top researchers medically in the neurology field for treating of those types of chronic disease of the brain. And I really like what he's doing. Now, I've gotten acquainted with a dentist recently who's actually showing cranial pressure and loss of cranial movement in the cranial structure is a strong link to decreased circulation to brain, and he's actually showing where decreased circulation in brain is a link to Parkinsonism and Alzheimer's. And I think his research is pretty fascinating. In fact, he just met last month with a group of top researchers in Canada, and he just sent his research over to be reviewed for me to be able to review as well. So I'm really looking forward to seeing that. But just a little vignette.
Doesn't glutathione also help with sugar cravings?
So the question is, can glutathione also help with sugar cravings? Glutathione, as an antioxidant, it's the strongest antioxidant in the body. Okay? It is essential to all metabolic pathways, and so absolutely a metabolic pathway is a breakdown of sugar. If sugar is not being broken down efficiently or excessively, or is being reserved in a case of like diabetes and my blood sugar is going up, if my glutathione pathway is not intact, we'll see cell destruction, and absolutely then sugar craving would be associated with that. Okay? We see glutathione essential in the utilization of our thyroid hormones and conversion from inactive T4 to T3. We see it also help with the autoimmune thyroid in helping to reduce the autoimmune response. We see glutathione is very, very essential in cases of Crohn's disease in protecting this barrier we call the GI system or the large intestine, where we start to see ulcerations and bleeding in this large intestine. So the glutathione pathway is essential for repair of this GI system, and it's one of the first things that we target for healing someone with Crohn's disease. Okay? Because without that, there is no ability then to truly heal linings. Okay? Antioxidants actually help to reduce the oxidation response or the destructive pathways of oxidation. Okay? So what's oxidation? We talked about that. Remember when we talked about antioxidants? Mm-hmm. If we lose electrons, we're oxidizing. Okay, so Leo. And then if we gain electrons, we're reducing. Okay, so Leo says Gur. That's the mnemonic to remember that. So lose electrons is oxidation, and gaining electrons is reduction. The body, as it's losing electrons, that's breaking those bonds and creates then a free radical, a hyperactive state, and it's looking for stability. It will look for stability in many places. And sometimes if there's irritation, food sensitivities, a heavy metal toxicity, some type of an infection, those will create this instability or instability in the tissues and cause then disease, okay, or a loss of function. So when we look at this loss of function, what we really look for is then how can we most quickly, if we see a loss of function or a true malfunction, how quickly can we restore this key pathway to restore optimal or normal function? Okay? And the glutathione pathway, phase 2 detoxification, is essential to healing, and then essential then to liver and GI optimization. Okay? Everybody okay with that? Again, the website has more information on that, and actually has a little write-up by Dr. Karazian that you can read if you're not getting it quickly. But just for the simple take-home, glutathione is essential for phase 2 detoxification, reduction of autoimmunity, and healing the GI system.
So is glutathione something that naturally we have in our body that we get from
Great.
foods, or?
So the question is, does our body naturally have a glutathione system? Yes. Okay? In fact, it's produced here and utilized here, and that pathway then, if you're trying to use glutathione to affect other areas, for example, glutathione is great again for brain. Glutathione is very effective at reducing inflammation for arthritis. Whenever I go hiking, long distances or hunting, I take glutathione with me and I put it on my knees after I've hiked a lot, because if I'll do it at night, by the morning, my knees aren't stiff. Okay, but that's something that works for me. And that also can be an indication that then my glutathione pathway isn't as efficient. Okay? Because all the friends that I'm with, well, most of the friends that I'm with now, they're worse off than I am. Okay? but ideally, we shouldn't have to. Okay? Ideally, our pathway should be efficient enough, or ideally, we shouldn't be pushing our bodies so hard that they're breaking down. So,